Still in shock over the sudden death of former One Direction star Liam Payne. The 31-year-old died after falling from the third-floor balcony of a Buenos Aires hotel yesterday. Staff at the hotel had called 911 just moments before to request urgent police assistance, saying that the singer appeared to have been under the influence of drugs and alcohol and was acting erratically. Authorities are investigating the circumstances surrounding his death. Joining us here tonight is Melinda DuBois. She is Executive Director of Mental Health Advocates of Western New York. I so appreciate you coming here, and I want to say from the outset, Payne had previously opened up about mental health struggles, and we heard about what happened at the hotel before this fall. We don't know exactly what happened. There are a lot of unanswered questions. What we do know is that when things like this happen, they're so shocking to us, and if anything, if there's any good that can come out of it, it opens up a conversation. What should people know as they're processing this?
Right. I think it is an extreme shock for many of us, especially our young people who have grown up with One Direction being such an important part of their lives. Like every day, they feel like they know these stars. And so I think it's really important for us to, like you said, open up this conversation because it's such a tragic loss. And it also helps us think about grief in our lives, right? So grief of a person, a celebrity that we don't even really know, can also bring up grief and loss of people that are close to us in our lives that have passed.
In addition to having those conversations about how we sort of process all of this, it's also an important reminder to let people know of the resources that we have. And I'm sure that Liam Payne's family wishes that he had taken advantage of some of the resources that are available. But we are so fortunate in our area. I mean, there's a lot of help out there.
Right, yeah, I think that really is important. I think that's part of the conversation to have. I just had a conversation with my daughter and said to her, you know, I know that this is hard, but there's help available. And for us, I think one of the most important things to pay attention to is the number 988, right? So that is the suicide prevention hotline that everybody should know about. It should be plastered all over your home so that you know that resources are available. But at MHA, we also have, at Mental Health Advocates, we also have resources. And one of those really important resources is our teen chat line. And that is a resource available for young people. You know, actually anybody can access that line, but it really is an opportunity to talk about your feelings, talk about the pain that you might be feeling, and getting the help that you might need.
Yeah, and we were showing that while you were talking, that resource. I only have about 30 seconds left, but I wonder if we talk so much about the stigma surrounding mental health. We now have that national suicide prevention hotline. Are we doing better at breaking the stigma? Slowly but surely?
Yeah, I think we are, but it never ends. Yeah. Like having conversations, talking about celebrities that have passed away is really important, but we also have to talk about our own pain and struggles, and the more we talk about our own struggles, the more we allow other people to talk about their pain and struggles.
And I want to leave those numbers up for just a moment right there, mental health resources. If you don't have time to maybe write them down or memorize them, grab your phone, take a snapshot. Such important numbers, and perhaps the easiest one there, obviously, 988, the National Suicide Prevention Hotline. Melinda, thank you so much for coming in. We're so fortunate to have mental health advocates and so many organizations in our area. Good to see you.
Thank you so much.